Hi, I'm Dr. David Mashahhadian from Rodeo Surgical Art. I want to talk to you about the exciting features of the new breast implant currently available. There are a variety of size and profiling and consistency of the gel. I want to inform you about it, get you educated, and take some of the anxiety of choosing the right size implant. There are many options, and always look to your surgeon to help you pick the correct size. But I want to give you some educational information about it. First, we're going to be starting with the Saline implant. The Saline implant is made out of silicone shell. They are usually smooth or textured. It has what they call a fill valve and a fill tube. During the procedure, your surgeon will place the fill tube within the implant, and then it's filled with salt water. Once it's filled, the doctor will pull out the fill tube, and then your implant is filled out. I want to speak to you next about the advantage and disadvantages and pros and cons of saline versus silicone. The silicone implant is a superior implant in a sense that it feels much more natural, basically molds into your body, less chance of rippling. However, it is a more expensive option. Next, we're going to talk about the implant sizes and their profiling. Previously, the neutral implant, which is made by Allergan, had profiling called moderate, high, or extra. And they have changed that during the past year, and the old version, it is no longer going to be available. Currently, we can see this is the old version of the high profile implant. You see it has a flat top. The new version has been overfilled, thereby now creating additional versions of the silicone implant. So I'm going to go ahead and remove the old version since these are no longer available. We are going to be talking about the two silicone implants. These are the basic gel implants. They're called the SRM and the SRF. These two are the same volume. However, as you can see on the M version, the implant is flatter and wider. This is the high profile, which is narrower and taller, and there is an extra full version which will be even more tall and even narrower. Your surgeon will make a decision based on your body type and your wishes, and the way you want to have your outcome will decide and help you guide you toward the right implant profile and size. Next, to make matters even more complicated, along the size and the profiling that's available, the implants also come in a textured version. The textured version is very different than the smooth version. The textured has velvety texture. This allows for different type of reconstruction or cosmetic procedures. There's also the 410 implant, which is an anatomical implant which maintains its shape, is the teardrop. Generally, this type of implants are not recommended for cosmetic procedures, in my opinion. It's more for reconstructive. Next, we're going to talk about the type of silicone gel implants that are available for your choices. We already talked about the type of surface being smooth or texture, or profile, or the volume. Now we're going to talk about the three different gel. Your first one is what they call the SRM or SRF or SRX. This is the thinnest gel material that had been available for many years. That implant has evolutionized to the next, what they call a soft touch. The middle of the three nomenclature signifies what type of implant you have. So in the middle of the three letters, you will have an S, signifying the soft touch. This gel consistency is slightly thicker, thereby less chance of rippling. Finally, you have your cohesive silicone implants, the gummy bear implants. Those are the true gummy bears. They maintain their shape, they have the thickest gel, they have the C in the middle of the three lettering. So something like this, which is a high profile, will say SCF, C standing for cohesive. This implant is the thickest, lowest chance of rippling. In addition, if there's any rupture or leakage, This type of implant has the lowest chance of the silicone traveling anywhere within the breast pocket. So you may ask, how would you decide to make these choices? Well, I think you should look to your surgeon as the best person for guide. In our practice here in Rodeo Surgical Art, we have a variety of technique guiding the patient and helping them making a final decision about the correct size, profile, and the consistency of the implant. We always customize the implant to the patient. I never make a decision during operation. This is a well-orchestrated procedure. We know exactly what things are gonna turn out and how they're gonna turn out. And I inform the patient very well, they get very well educated, and I help them make the correct decision. Again, if you have any question or concern, visit our website for highly educational content at rodeosurgicalart.com, or visit our Instagram for before and after pictures and informative video clips.